Hi, my name is Natasha Zudina and I'm a founder of the project Open Window. Welcome to our 30-day challenge, a tip a day on treatment of autism. Today we continue in our topic on signs of autism. We already talked about typical signs, atypical signs, and today we will be talking about body dysfunction signs of autism. And the reason I'm talking about this is that the industry of the autism treatment is changing, and it used to be that most of the medical professionals would consider autism is a brain disorder. Now there's more and more research about gut and brain connection. So more and more articles are coming out and they talk about autism actually being a body disorder that causes a brain disorder. So if we change that perception and we will treat the body, then we can fix the brain. So how to determine whether or not your child has the body disorder? And when we talk about the body disorder, we talk about gut dysfunction. So why autistic children have a gut dysfunction, we'll talk in the other videos. But today we're going to talk about signs that will help you to determine whether or not your child has a gut dysfunction. So if your child has asthma, eczema, or allergies, doesn't matter, food allergies or seasonal allergies, most likely they also would have some gut dysfunction signs, such as diarrhea or a constipation. And under constipation, even if there is a 1-day delay, it's considered to be constipation. Sometimes the child would have some kind of odd combination of constipation and diarrhea, which would mean that for a few days they will be constipated and then they would have it, but they will be in form of diarrhea. When the child would have very frequent flatulence and bloating, where they would have a very smelly stool, the odd color and the odd consistency, where the child would actually have a large tummy past 2 years of age, where the child would have very pale complexion with dark circles under their eyes, where the child would have a weak muscle tone, but yet they would be hyperactive and run around and will be hard to settle, where they would assume weird poses just before they have to go, usually leaning on their tummy, where they would be having difficulty to be potty trained, and especially on number 2, where they would have a very limited diet, where they would limit it themselves and they would just eat some crackers and cookies and maybe milk or sweet yogurts or cheese. But they would refuse to try any fruits and vegetables and meat. All of those signs are the signs of the gut dysfunction. Therefore, if you said yes to 2 or more of those, then your child most likely has a gut dysfunction. Then it could sound kind of odd, but this is great news because we can fix that. We can treat the gut dysfunction with special diets, and that will help your child's autism condition as well. More about that in the future videos, and please ask questions on our Facebook page. And stay tuned.